Namaste friends, welcome back to my channel. Today we will be discussing around how I actually use artificial intelligence in everyday practice and can the use of artificial intelligence in everyday practice can really improve the patient outcome and does it make our life simple. What I am not going to tell today, I'm not going to tell about the things that are very futuristic in it with respect to artificial intelligence, like auto interpretation of the ECG or the patient directly taking to the AI doctor and getting the treatment. I'm not going to discuss that. Neither I'm going to discuss about the scans which are being reported by AI. These are maybe a future. They look like something which is totally out of context to me at least. See, as a doctor, I do see many patients every day. Being a cardiologist, the referred cases are complex. Usually, they come with multiple complications. They could be having diabetes, they could be having a past stroke, they could be having even sometimes malignancy. And when dealing with such patients, the data of the patient is really very important because your treatment, your plan of decision, what you're going to take, does have to be. We need to take into consideration what patient is already having, what patient already has complications, what thing can go wrong. So this is definitely a complex issue, and we all know that dealing with such patients requires a lot of investigation in the patient's past history. And we as Indian patients don't give the complete past history. Neither there is a good mechanism we have developed to keep the patient past history such that we can give a better treatment to our patients. So unless we come out with good hospital information management systems or we are recording properly all everything, treating such patients becomes very difficult. And of course, the government of India is on the move on digitalization of hospital records, that is Ayushman Bharat digital mission. That is one more dimension which is going to help use of artificial intelligence above EVDM to improve the patient's care. I personally don't believe that AI is going to be something which is being totally detached to the humans. See, all that we have created on this planet is by the humans, for the humans, and will be definitely for the use of the humans only. It is nothing like the totally will get detached. So the AI would always be like a partner in your treating the patients. That's how it's going to happen. So naturally, the way I am going to use AI, neither with our hospital information management system, that is NICE HMS, how we have implemented artificial intelligence so that it becomes easy and good for treating the patients. That is the things that I am going to discuss. Now, as I gave in the context before, the patients being having a data that is very complex. It is, don't you think, or don't even I personally find it bit complicated or bit very overwhelming when a patient comes to you with a history which is not fully known. And if you have a data in your HRMS, which is of course it is there, but can you really go through all the patient's file, big file? Can you really do that? Just imagine a bulk of the patient who is, of course, whether digital is digitalized or bare papers only, all written on papers. Just imagine yourself, patient submitting you with the huge data. And further, these days the patients are coming with the lab reports, big bulk of lab reports, which are done by big lab chains, like big lab chains. They go there, they get their master checkups up, then you get such a big bulk of lab reports. If the patient puts it on the table and he asks you to see that, it will be at least 30-40 pages of reports. And that in the 30-40 pages of reports, the more than the actual values or the more than the required ones, there are many unrequired, unwanted stuff like interpretation of the thyroid profile, how to interpret. There's a big list is there, like documentation. Everything they give in such a way. And as a doctor, we don't want that actually. We want the values, basically. We want the values, and we want to take a decision on that. Reading such a complex, unwanted reports, one is one thing, and other part is the patients will have records which are disconnected. So one file is there and other one is not there. Trying to make a understanding between those two are hampered in between is also a complex job. You need to imagine probably this file is there, this drug was given, probably that was must have happened. That's sort of a thinking you'll have to go under. So when you are dealing with such patients who have got a data which is totally uncorrected and which is complicated and which has got a lot of multiple problems, you alone as a doctor finding out the actual problem of the patients, don't you think it is a hard thing? It is actually. You may miss many things. For example, even one patient who had come to you in the past, if he comes in today and if he complains something, and if sometimes you will find yourself disconnected, what could have happened to this patient? Why this patient changed like this? And this is the way I personally find the artificial intelligence is going to play a big role in treating the patients. Now, having said this, I will also give you the actual real world examples, what happened and how the use of artificial intelligence in our hospital information management system, that is HMS, helped us to find the actual causes. There are plenty actually, there are plenty of cases which are there. I can't make a big list of it because otherwise the video will become very long. One or two recent ones I am going to tell today. Yesterday only, I'll tell you one patient which has come yesterday. And this is a patient who had undergone angioplasty around 2-3 years back. And following that, he had actually a dysfunction. He had a liver dysfunction. And his ejection fraction was something down to 45, 35, that was 45. And it started falling down to 35. So last visit in September, he came in September 25, I believe he had come. Around with ejection fraction, I checked it was 35, and he was complaining of breathlessness actually. His NYHA classification had increased, so he started having breathlessness. And his BP was okay, 110/70 like that. He was already on drugs. So I thought of let me build up some diuretics because he was having symptoms now. So I added a more tablet with toracamide with aldactone combination. I added one more and sent it. And that patient yesterday came. He came and when he came, we actually what happens in my hospital clinic is the first is it is seen by our nurses. They will check the blood pressure, they will check all that. They will enter in our HIMS the blood pressure. They will enter in HIMS. The blood pressure was 86 systolic. Down, actually 86 was down. It was systolic. Then of course patient was having giddiness. He was classical having orthostatic hypotension. Now, it is very easy to pick out that this is the hypertension which has happened because of drugs, because I have added. But the thing is, I had forwarded. I have recently, now the estimate patient came yesterday. I personally thought that this patient is on these tablets since many days. That was my initial thinking. But as a patient, BP was 86 systolic, as usually, but I do use air. So then in my HIMS, what it does is I will summarize all the patient's records. It just takes up the data, automatically picks it up, and BP was down, and when I clicked the button to generate a AI summary, then it came the last visit you have added data plus LS, and below that there is a BP rating which is low. It is correct. Now, see, I don't, anybody would be, I know, you can pick it up, you will understand the drugs are more, that's the reason the BP has gone down. But in a given case, if the patient is having same drugs since many days, if the BP has come down, we would bet not primarily on the tablets. because I could easily find out this was a recent change which I had made, which AI prompted to me that the BP is down and the patient is having hypertension. The decision is very simple for me. Then I just knew that this patient, just because I added dietol plus LS for his breathlessness, and I need to stop that. In fact, I did get his blood investigations. Of course, there was after the blood investigations reports came, there was a hyponatremia. And once more I challenged the AI. It said, see, the patient has ended up with hyponatremia. Again, it alerted the tablet there down. Now, naturally, now I know the tarsamide dose, which has been developed was one of the reasons for his hyponatremia. And so naturally, what I did was I knocked out both the tarsamide and added him a hyponatremia. So that's how the treatment for this case became very simple for me. Otherwise, I will be thinking in my brain what is going on. Did patient have one more complications or has he got something else? Because the AI now has given me a very easy insight, the cause. And further it does warn me, now it tracks even the weight. This patient is losing weight since last month. Now you know that you are dehydrating him with the drugs, that could be the cause for weight loss also. And there could be other causes. Now, at least I asked him to come after 1 week now. The weight loss is there, hypertension has happened, hyponatremia has developed. And just because AI picked it up and warned me because you have added one more tablet of dietol, so these complications are happening. So, just imagine, I don't say that without AI you can't do, but with AI, now I am more confident and my decision has become more simple. This is how the recent episode. Now I want to discuss one more patient, how the AI helped me with nice HMS. See, the patient had undergone permanent pacemaker implantation around 15 years back. 15 years back. So not 15, 10, 12 years back. I don't know where she undergone. That patient was having giddiness and moving everywhere. She has met multiple consultants. And in fact, she had what was the problem was, she didn't want, she had got frustrated, nobody was telling her what is the cause for her giddiness. Nobody caused for giddiness, and she was a village patient. She doesn't maintain proper records. She comes with a big chunk of a file where many things are there, including their some bills of the kirana shops, including everything in that bulk was there. Such is the way the patients keep records. So naturally, if a patient comes and dumps that in front of you, you figuring out the actual medical record in that is not easy. Now naturally, what I did was when the patient came, I asked her to undergo at least ECG because she was a really poor woman, and she was already frustrated. She didn't want to do anything. So okay, followed it. Now thing is, I asked sister to separate the documents and find out what you think are medically relevant. You keep them out. She took them. Then it turned out to be a few more, about 15 pages now. Naturally, I was not very much keen in going through every record. So I asked sister to upload those scans, and there is an HIMS of nice HMS scan them and upload them in our hospital information management system, that is nice HMS. She uploaded, and then after once the data was uploaded, then I just clicked give me AI summary. In that, what has happened was the patient has forgotten her pacemaker implantation. She doesn't know. She thinks that is a cured disease forever. It is gone. Nothing is there. She does not. Now in that, there was one time pacemaker implantation examination done. That was done around 10 years back by I don't know whether it's St. Jude's or Electronic. That engineer had evaluation had done. That report was there. That as well got scanned, and it came. There is no other report of actual pacemaker implantation, no post-procedure report, no discharge, nothing is there. But this was more like looking like a receipt. I personally find that patients love the receipts rather than the patient records. They try to maintain the receipts more than the doctor's prescription. I find this something funny. this is a personal observation, I think so many of you do agree in this. So this patient, probably it was a misapplied, she had preserved it more than anything. So that got scanned in, and now the AI told me this patient has undergone pacemaker implantation. There is an evaluation done 10 years back. After that, nothing is there. Now I know there is something. Then I asked her, what have you undergone a pacemaker implantation? Initially, she said what she was not very clear about it. I asked her, had anybody put something on the shoulders here, or below skin operation and done something? Yes, sir. It's about 12 years back in Bangalore we had done it, and I'm fine. That is our story. There's nothing to worry about it. And I said, no. See, after that, have you examined your pacemakers? She said, why should I? She doesn't think it needs to be done. She probably doctors must have told her. She must have forgotten. So then I asked her, see, you have undergone that. Now you need to check the pacemaker whether it is like there or not. So I called the pacemaker engineer. He checked it. The battery is dead. End of life. Now this case had met multiple consultants, and none of them, for her, none of the consultants she has told the pacemaker implantation. Nothing has told, and she was frustrated, irritated now. Just because this AI could tell me that this patient has undergone pacemaker implantation, I could easily get it now. She needs replacement of battery. Then I got a case for one of replacement of battery with help of just by scanning and reports. The AI could picked it up and told me. These are many examples are there like this. The AI, how AI is improving my medical care. And I have discussed about these things in one of the previous videos which I have posted there, where the AI is summarizing, and also it is writing discharge summaries. And that link I will give. You can go through that. That's one more thing. And if you have anything to comment, like how you use AI in your daily practice, or you want to suggest anything more, please do comment and subscribe in the below in comment section, and subscribe to our channel. Thank you.